Well, hello, everyone. My name is Basil Torab, and I'm a Master in Healthcare Administration and a member of the Syrian American Medical Society. Today, I have two special guests, Ms. Sherry Roberts and Ms. Dania Al-Itani. Both of them are wonderful nurses, and I will ask them to introduce themselves.
Hi, my name is Dania. I'm a registered nurse based out in Los Angeles, California. I'm also getting my doctorate in nursing practice.
Thank you for being with us today, Sherry.
Thank you for having me.
My name is Sherry. I'm a family nurse practitioner specializing in emergency medicine here in the Washington, D.C. area.
Thank you for being with us today as well, Sherry. Sherry, I want to start with you. How did your work change with this pandemic?
Changed rather drastically. We went from seeing lots of walking well, worried well patients, people who were just worried because they'd heard about the virus and they were worried and concerned, but they had absolutely no symptoms. And then very quickly we transitioned into seeing lots of patients that were starting to have shortness of breath and feeling, this exertional dyspnea. And we were very, jump on those patients and really aggressively treat and consider hospitalization. But as we've gone through this process, we're actually discharging more sicker patients than we typically do, because we're trying to hold these beds for these second week virus patients who have this bilateral pneumonias and exertional hypoxia. So it's just amazing in patient care terms of how we went from this worried well, being overwhelmed by worried well, to being overwhelmed by sick but not overly sick, to now we're kind of seeing all of that, and so we're a little overwhelmed.
Understandably, I mean, the emergency department is a crazy environment in regular times, never mind the pandemic. Dania, how about yourself? How did your work change with the pandemic?
For us, we started off with a lot of uncertainty, and every day we have new policies and procedures that are being put in place to try to adapt to the changing times. And honestly, I'll be gone off work for 2 or 3 days and I come back and everything is different. So I think for us, mostly what changed is how patients are being triaged into inpatient settings. So from the ED, kind of like how Sherry was mentioning, we kind of determine whether they're going to go home and self-quarantine or if they need hospitalization for acute management. So that's been kind of the difficulty, is trying to figure out treating them, what they need, where they belong. Should they be in the ICU? Should they be in our COVID unit? Could they be in our acute respiratory unit? So we're just trying to decide. So for a lot of it is every day is kind of figuring out what kind of patients you're going to get and how you're managing, as well as we work a lot with discharging patients to skilled nursing facilities. So that's also changing drastically, because our relationship with post-acute facilities is also changing, because they're also very scared.
I can only imagine. So Sherry, can you comment on the kind of patients that you have been receiving in the emergency department?
Sure. I think initially, maybe a week or two ago, we were seeing just a huge influx of very sick COVID-19 patients. And now we're starting to see, so we had this huge fallback in numbers in our census of patients coming in with their heart attacks and stroke-like symptoms. And we were just seeing these COVID patients for about 2 weeks. And now we're kind of transitioning into really sick COVID patients with high acuities, but also the chest pain for a week, where they actually had a heart attack and just didn't come in. They were afraid. Stroke-like symptoms, where now we're outside of that 4-hour window to be able to do a whole lot about it. So we are definitely seeing people waiting with abdominal pain for 4 or 5 days and having a ruptured appendix. So it's a higher acuity patient, not just with the COVID patients, but these patients who have been afraid to come in, afraid of getting the virus by coming in. Their family members are afraid to even bring them in. So we're seeing a lot more medics bringing patients in with non-life-threatening issues, but just because the families are afraid to bring them in. So that our census has definitely increased. The acuity has definitely increased, not just with the COVID patients, but these surgical emergencies, these stroke and heart attacks, that people are just afraid to come in and they're waiting too long.
I see. Dania, would you say that you are also saying mainly?
It's beyond, she hit it exactly on the dot, because patients are afraid to come. So I work on an acute diabetic unit as well as an acute respiratory unit. So we're having patients that are, missing their appointments with their diabetic management, and they're coming in with DKA and HHS and all those like side effects that we have when your diabetes is not controlled well. We also have patients that are missing their dialysis appointments because they're afraid to come in for their scheduled dialysis. So we're having to deal with all of this that usually should have been under control if the environment was normal. And it's bringing a lot of toll on like nursing staff as well as doctors as well as our ER staff, because it's like now in California, our patient ratio is a 5-to-1, but in reality, they're so acute that they should be a 2 or a 3-to-1. Because there's so much that's going on and so much side effects that we aren't used to dealing with. So it's been a huge learning curve for all of us.
I see.
May I interject one thing? I know with our units, and Dania, correct me if if it's not happening in your unit, but our nursing homes are afraid to take those patients back. They want quarantine for 2 weeks in the hospital. So that ties up a bed, even if they were from home, but now they need that skilled nursing. The skilled nursing units aren't taking those patients, and they can't go back home because they need a higher level of care. Those units, at least our units, and I guess Dania's as well, completely overrun and overwhelmed with not sick enough to be in the hospital, but nowhere to send them as well. And that is a huge suck on resources, a huge resource use.
And we're also seeing a lot of patients with their insurance situation being changed because they've lost their job or they don't have access to insurance. So it's like, even for patients that don't have COVID-19 or have like other respiratory illnesses like adenovirus or influenza A or B, and they need isolation, we don't have a place for them because people are simply scared.
There is a problem with this position, as you are explaining, with patients who come here. I would imagine, I'm going to go back actually to your earlier comment, Sherry, when the patients are coming in the ambulance without their families. I would imagine this is very difficult for patients, but how does it feel to you as a nurse to have a patient coming with no support as usual?
To walk by and see them alone, struggling to breathe. Now nurses are going in and out, of course, but as nurses, we're not able to give the compassion. It's really hard to relay compassion and concern and care through 5 layers of PPE. You sound like you're screaming at them all the time. And one of the first things I always say is, remember, I'm smiling to you. And I say that in Spanish, I'm smiling. This nurse cares about you. But then I have to leave them, and I leave them alone. And I leave them isolated, and it's hard on the heart to see that. It's hard when you want to be there, but I can't keep using up PPE for anything more than something physical. The emotional is where I think as nurses, we believe in a holistic care. And I think that with this COVID thing, it's really affected my practice. I don't have the families there to offset that. Usually we include family members to offset when nurses can't be there, or we have case managers that help and child life that helps. And that's really lacking right now because of the need and necessity of PPE and visitor isolation.
I see.
Yeah, I was going to say, I agree. And a lot of things that we're seeing that we haven't really seen before is a lot of ethical considerations. So it's like, where does our duty to serve and duty to treat lie? Do we risk our own safety and our safety of our loved ones for the sake of being a compassionate and a great nurse? I remember I had a patient maybe 2 weeks ago. I was in the COVID unit, and his whole entire family was admitted into the hospital. His wife was up in the ICU. He was down in our acute respiratory unit, and then his daughters were isolating at home. And I remember he was so tearful because his wife, no one was updating him. She wasn't around. His daughters couldn't come visit. And it's like, I can only come in to give some medication or to increase his oxygen or do my daily assessments. But it's like 5 minutes, I'm in and out because we want to try to decrease our exposure. Even doctors are calling into the room versus going into the room because they don't want that exposure because they see so many people. And so it's that transmission that we're worried about.
Can you comment on the emotional side of this, for the patients, not being able to build connection with nurses in the same way they would do in the normal situation? And also, can you talk about the quality of work that nurses are providing to patients? When there is less communication, there is less quality care. Can you comment about that?
I think the biggest thing, like nurses' role in addition to how they're managing care, is that we're patients' advocates. So a lot of times we serve as their voice to get things done and get things taken care of for them. So personally, like speaking for myself and what kind of nurse I was before the COVID-19, I definitely see a shift in my practice because one, I'm overwhelmed, and two, I'm scared. So a lot of times I'm in there doing just acute management versus providing that holistic care that I pride myself in, that my hospital prides themselves in. And, you know, we have what we call a simply better experience in our hospital. That's kind of our motto. So we make sure that everything's taken care of from a patient, including their psychological well-being. And so honestly, I feel like that's really being hindered because of the environment that we're in, and it's very, very unfortunate.
And Sherry, what do you think?
Yeah, answered it very well as I would. We're nurses, nurse practitioners. We believe in a holistic approach. One of the reasons I went into being a nurse and being a nurse practitioner was because I saw that one of the biggest pitfalls in healthcare was that we weren't educating families. That when one person in the family is sick, it affects the entire family unit. We've seen that in Jordan at the refugee camps. When one person in a family is affected, the whole family has to bear that burden. And with this COVID-19, all this PPE, and sometimes I can't go in the room. An iPad goes in for me. But I'm not able to teach the family and talk to the family and treat them as a whole, as that unit. And so you've got these fragmented pieces. And Dania brought up the ethical concern. In the Mexican culture especially, if all your family isn't there when your toenail's removed, something's wrong. You are not loved. You have been forgotten. And that is such a real thing in a lot of cultures. And I think as nurses, we're such big advocates that if patients don't have families there, we're there for them. And this is definitely not the case. We're lacking the ability to give good education to the families. We're not able to give our families and our patients that compassion and that kind of moving through the process together.
And Sherry, can you comment about the patients who are not COVID-19 patients? Do they have the same feelings, like, more anxiety? Like, do they show understanding that you have to be, under all those PPEs?
Well, I think they understand the reason for the PPE, but a large part of our population that come in for non-COVID reasons, they're very short-tempered, very anxious. We have a lot of people coming in just with anxiety. Anxiety-related, issues where they're home with their families. We're seeing a lot more domestic violence. So although I think they understand the PPE, we really have to be understanding that there's a lot of underlying anxiety about what's going on in our culture, that they're having to sit here in a place where there's a potential exposure. They're already worried about their own exposure, about getting it from us. And so it's kind of a multifaceted problem. I feel like.
My next question to you is, how this COVID-19 pandemic changed the interactions between nurses and physicians on the floors? The communication, the interactions. Can you talk a little bit about this?
I think the biggest thing is that we're having a lot of people transition into kind of more specific care. And so nurses are taking on a bigger load with assessments and putting in orders for doctors, as well as just kind of managing patients that are kind of out of our scope of practice. So we're seeing that huge adjustment because doctors, a lot of them are actually out sick. So we're having to kind of deal with less specialties. We're having to wait for doctors to come in and do consults for 2 to 3 days at a time, and patients are just waiting here, getting aggravated. And it's been now more than ever stress, teamwork and team effort and all, because patients won't get better if not everyone from the interdisciplinary team is working together. So we're feeling that lately it's been kind of tough, and our roles are shifting and changing and trying to adapt. So I think that's the biggest thing, is that we're working on relying on each other.
And Dania, have you suffered of shortness of providers in your area?
We definitely have. Doctors, a lot of doctors are self-isolating after being exposed, but we are seeing a shortage of COVID specialists like pulmonologists, as well as infectious disease doctors. And so it's kind of been tough. It's tough to get a hold of them because they're in rooms with PPE and they're not around with their pages or their phones. And so And we're also seeing a lot of shortage in ancillary staff, such like respiratory therapists, physical therapists, which are all so important to a patient progressing back to their well-being, and they're just not around as much.
Do you have the same conditions, or do you feel that you are in a better place, not better place? Can you talk a little bit about that?
We actually have had not one of our providers has come down with COVID-19, not one of us. So we all figure we either got it already in December, January, because we were all sick around then, or we're just doing a really good job with our PPE and hand washing and all that good stuff. No, I feel like at least in my facilities, we actually have had a lot of people stepping forward. So the emergency room providers also, a lot of them are critical care specialized as well. So they've been going up and helping in the units. I did want to touch on something that you asked Dania about the communication between nurses and physicians. And one of the things that I'm seeing, because I'm a nurse practitioner, so I'm kind of between the two roles a little bit, is a profound appreciation for nurses from the physicians. Like they didn't really understand just how hands-on they are and how much work they do and how, how draining it is as a nurse to try and give that holistic care and follow orders and do all of these assessments that they're asking for with 5 patients. So I'm seeing a greater, more profound respect from the physicians to our nursing staff.
I'm glad that your staffing, is, you are in a better place staffing-wise than Dania. But what about the PPEs? Have you suffered any shortness of PPEs, or are you in a good shape? Can you tell us, Sherry, some of the practices that your work areas or workplaces have been doing to preserve this very valuable PPEs that everybody is talking about now?
Right. Resources have been very diligently doled out, so it's interesting how, and I know Dania will agree, that before all of this, one mask, one gown, and very specific parameters and about how many times you can use things, and you could never reuse anything. There's never anything in the hospital you can reuse. And to be told that, oh, now you can reuse was a very strange feeling, I think, for all of us. So I feel like we were using N95s greater than I had ever done before, was even particularly comfortable with. However, my facility really got on top of it and has gotten us these personal respirators that work for 6 weeks. And so now all the providers have those, and the nursing staff is getting them as well. So I feel like my organization has really stepped up to the plate to take care of the shortage.
Wonderful. And how about your organization, Dania?
Yeah, at first, kind of like everyone, I think we were all short, but the more that we kind of got support from our community and support from our local, and then especially our manager stuff in the hospital, we actually now currently have a warehouse filled with PPE, enough to last us till September. And a lot of it was because of donations from our community members. We serve a huge, huge, huge population in Long Beach, or in Los Angeles as well. And so thankfully everyone's been looking out for us. We are pretty strict on who can use them. It doesn't mean that we're short, but if you want an N95 mask because the patient has a UTI, you're not going to get it. I mean, it's available, but they are very strict on who can access it.
And you said, the community is, helping you and supporting you. Dania, what has been the most rewarding part of your work during this pandemic?
2 things. I think a lot of times nurses aren't given the credit that they deserve, kind of like what Sherry was saying, that people don't really know what we do, but now they do. And it's pretty great that we're doing this interview during Nurses Week, because it's really, really shining on kind of like what we do, what we contribute, and just how important we are to a patient's well-being and our role in hospitals and in outpatient cares. So I think the biggest thing is that people are really grateful. And 2, I think seeing the community pull together. So we do, in our area where we work a lot with small businesses. And so a lot of people have been suffering, but it's crazy because every day small businesses are donating food, coffee, everything that they can imagine to our nursing staff. So I think that's been really nice, is seeing that they're putting frontline workers priorities. So it's kind of cool.
This is very nice to hear. What about you, Sherry?
Well, I think my favorite thing right now would be how everyone in the hospital is coming together, whether it's our environmental services, it's our sitters with our anxiety or mental health patients that are coming in. It's the radiology technicians. There really is a more profound respect that's given, less short-tempered. Where's my lab? You don't hear anyone griping or complaining when things are late or things are taking a little time. There's really a feeling that we're all in this together. And no matter how, like it was a little rough night the other night during my shift, and the doc shook his head and he's like, oh, they just keep coming. And I'm like, but we're in it together. We've got each other. And that's just the best feeling of having a team that's in flow, and that everyone seems to be feeling appreciated and appreciates each other.
Sure.
The local Krispy Kreme has on Mondays during this couple of weeks, they give a dozen or two free donuts, right? So each Monday, my daughter and I, if I'm not working, we go and pick up the donuts. And so I called in and told them I was coming, and then the nurse manager of the emergency department said, well, don't bring them to us. EVS is having their big meeting. Let's give our donuts to them. And I actually saw some of them like getting teary, like, you guys really appreciate us. And we're like, yeah, we really do. And so that, was pretty cool.
Thank you for sharing that with us, Sherry. Dania, do you have any good stories with us?
Maybe about 2 weeks ago, Snoop Dogg purchased Chick-fil-A for everyone at our hospital, both on our adult side as well as our pediatric side, because we're 3 hospitals within our campus that I work at. So Snoop Dogg went and purchased food for everyone, and so that was really great. I think too, just seeing like small gestures here and there, people dropping off cards. So our cancer kids that are across the street, they're super high risk and immunocompromised, especially during this situation. And they're usually there for a really long time. So our child life agencies had them do cards for everyone. And so now patients on their lunch trays every day get a photocopy of that card, and it says like, get well soon, or like little tiny gestures of encouragement, which I think we can all use. So every time I see them, I smile a little bit, because it reminds me that, like, regardless everything that's going on, we still have that humanity and that compassion, and that's why I love being a nurse.
Absolutely. Well, thank you for sharing that, and I'm hopeful that those nice gestures and practices continue after the pandemic.
I hope so too.
We all know the pandemic gonna go, but hopefully those gestures will remain.
Yeah.
Sherry, speaking of the pandemic going, how do you see your role as nurse practitioner going after the pandemic?
I'm a little concerned with where we're going, at least as our nation progresses, because I always wash my hands and teach about good hand hygiene before the pandemic. So I think that me moving forward is going to be really putting a greater focus on people that the mask is great and gloves are great, but basic hand hygiene, basic hygienic practices are what's going to keep people healthy. And I feel that I'm going to have to really incorporate that inside my practice on a greater level with each patient that comes through. Again, I feel like as a country, we're going to move forward and everyone's going to think, oh, I'll wear a mask and I'll be fine. But that doesn't really protect us from pandemics. It's about being prepared for the next one. It's about updating yourself and updating your practice and moving forward, but also helping your patients to adjust to our new normal of, taking care of ourselves.
And Dania, what do you see the differences in practices between now and after the pandemic? Do you expect something to be different?
Definitely think a lot is going to change, but what specifically I wouldn't be able to kind of target, because we're learning every day what works and what doesn't work. So I think maybe in a month or 2, things are going to be much different. Our environment right now is different, especially with no visitations and just limited contact and all that. But I do hope that it is going to make us much better and much more prepared the next time this happens. This isn't the first pandemic, and it definitely won't be the last one. We learned from the Spanish flu to the AIDS pandemic.
I'm hopeful that we will be more prepared. So now you said you triggered me by saying prepared. Now, Sherry and Dania, both of you, I think you work in fortunate places. We are here in the States, including myself. But what would you say to nurses who are overseas, like in Syria, or working in camps that have Syrian refugees, where they do not have the same resources as both of you? Sherry, what's your message to them? What's your advice?
My advice would be teaching hygiene as much as possible. Not just wetting the hands under the sink, but teach those patients that it's the friction, it's the soap and the friction with whatever water, sources that they have available. Ensuring that people are washing their hands before they eat, not touching their hands and face, and really focusing on that just very basic Florence Nightingale, salt of the earth, go back to the book nursing of how to treat people in resource deprivation environments. You really want to get back to those basic things. So don't overlook the basics. Remember, you're doing those nurses are doing amazing work with very little. So don't lose hope. We're not going to lose momentum here to help through SAMS. We're going to keep that momentum going. And remember that this is just for a short period of time, and we're all going to get through this, and we're going to bring as much help as we can, but just focus on those basics and be there for your patients.
And what's your message to them? And do you see any role for SAMS to help them?
So, Sher, I'm not sure if you had a chance to go on medical mission trips with SAMS in the past. I've had the honor to go.
Too.
Yeah, so I've had the honor to go on about 4 or 5 medical mission trips, and they've been on my mind more than ever lately because I know how scarce their resources are, especially clean water and soap. And so I'm really, really scared for them because they don't have the basics, and just their living situations and their close proximity to each other and their lack of hygiene resources and products terrifies the crap out of me. So I'm just like really, really worried for them. But again, very, very hopeful because we have organizations like SAMS, which are at the front lines, and they're providing medications and supplies as well as psychosocial support, which is a really, really big aspect to the COVID situation. So my biggest advice, I think, would be to kind of, which should be sucky because they survived so much and they've already been through so much, and a COVID, like the pandemic, is the last thing that they really need. But to use that hope that helped them. I'm speechless about this because it's just so difficult for me to grasp, and a lot of them rely on our resources that we give every year and the medical mission trips that we do. I know people like in Jordan, the Zatari camp, and as well as in Syria and neighboring countries, SAM's medical mission trips in Lebanon, people rely on us. And it's hard because I don't know what the future of that situation is going to be. So I pray for them every day, and I really hope that they get the help that they desperately need now more than ever. So
thank you. And Sherry, you have been in 2 missions before with SAMS. Do you see any role for SAMS for, to help nurses in this current pandemic? And, Dania said, we might be limited in our options, but do you think the internet, like online communication, would be helpful to nurses during this? Is it applicable in the nursing field?
I think it's very applicable. I think I think Dania actually nailed it. It's more about support. I can't get them more supplies. And I stay up, when this first hit, all I could think about was how I've been trying to get shoes donated, because I identified the last 2 trips that shoes, basic shoes, how everyone had feet problems, and how can I get them better shoes? And now we're talking about a pandemic. I'm worried about something that goes on their feet. And now we're talking about trying not only to keep patients healthy, but to keep the healthcare providers healthy. So I do stay up at night and I worry about that. And I worry that SAMS is going to lose momentum, and I don't want our group to lose the donors and lose our momentum for giving, the supplies and the education that's needed. I think as far as what we can do to help right now, it would probably just be hope and support, and that emotional support to say, you're not forgotten. And we as healthcare providers are there for you as healthcare providers, and asking what's needed. And sometimes there isn't anything needed except to have someone out there listening.
Thank you.
if we can learn anything from them, I think it would be strength. And so I'm really grateful that I got the opportunity and that I'm a part of SAMS, because it's taught me and grown me as a provider. And one of the many reasons why I'm going back to school, because I want to do more for SAMS and the people that we serve. So.
And SAMS is committed to help them. And thanks to the kindness, of people like you who provide support and expertise to our missions, overseas. I cannot thank you enough again for taking the time to speak with me today. Stay strong and stay safe.